When you're learning how to do various cosmetic procedures, what do you practice on? Is there like a fake body or a mannequin, or you just cut a random volunteer open?
I mean, at some point, you have to sort of grab the bull by the horns, as they say. They give you the knife and off you go.
Have you ever told a patient to go to a psychiatrist?
I've suggested it strongly without actually saying it.
Now skin is sagging
Yeah.
because people were on Ozempic and they lost a lot of weight.
When you factor that with Zoom has been a big boom for plastic surgery. Everybody looks terrible from below. You couple that with the sort of semaglutide boom, you're seeing a lot of people who feel like they're aging more rapidly.
When I go to the gym and I see that half the women have obvious implants, BBL, lip filler, like what is happening and have we gone too far?
There's no question that people go too far. I think part of that is doctor related, people pushing that idea that you can inject away aging. And I think that as a result of that, people are always chasing this ideal image of youth.
Welcome to Wham Bam Thank You Pam. I'm your host, Pam Gaslow, writer, former stand-up comedian, and mastermind behind the 50-year plan to success. I also learned the hard way that you don't bring your vibrator to rehab and wrote a book about it. Here we have bold, unfiltered conversations about sex, relationships, personal lives, and pop culture with a sharp, sexy, and comedic edge. Wham Bam Thank You Pam is the wildly entertaining, no-holds-barred discussion you didn't know you needed. Hey guys, welcome to Wham Bam Thank You Pam. I'm Pam Gaslow. Today's guest is a board-certified plastic surgeon in South Florida with over 35 years experience in cosmetic, plastic, and reconstructive surgery, Dr. Lee Gibstein. Hi, thanks for coming.
Thank you. Thanks for having me.
Yeah, and this is, I just found out his first podcast, which I'm really surprised because you're pretty well known down here.
Yeah, I've never had the opportunity to sit and talk like this, sort of a new experience. I'm looking forward to it.
I'm
It looks casual and fun. So,
I'm so
Let's
glad
do
that
it.
I invited you.
oh, well, thank you again.
Okay, so I'm really excited to have you here, and I have so many questions for you that we definitely won't even have enough time to answer them all. But okay, first we're gonna play a game.
Hmm.
I'm gonna write down how old I am, and you're gonna write down how old I look.
Wow. And this isn't like an honest thing, or we're gonna just go back and forth, make it up as we go along. But I'll do
No.
my best.
I'm his patient, so he knows my age. And what I liked about you when I met you was how calm and confident you were, and you take your time and you listen. And that's so important. You have a great bedside manner, and you really put me at ease, and you're not pushy. And these are all, I think, note to anybody who's looking for a plastic surgeon. These are really good qualities. And also, you have a great sense of humor, very dry, which is very similar to me. So we get along.
I'm blushing already. Well, I think when you're a doctor, and especially plastic surgery, because most of my patients are healthy, so they have choices. So it's important, I think, to try and connect with people. And I think listening, my dad was a primary care OBGYN. So I think I grew up with that mindset and mentality. I think it's helped me in my practice in terms of, listening to people, taking your time. And I think people are nervous, even though people are healthy and they feel safe. I think they're nervous. So making them at ease, letting them talk, listening to them, and trying to give them adequate time, I think is really important in a day, in a world where everybody is so rushed and everything is like 5 seconds long. So I try and not rush people and give them a lot of time in the consult. And everybody has my number. They can always reach out to me. and
Everyone
get a
has
hold
your
of me.
number?
Almost everyone. Yeah. So I know that it makes people feel like they connect with you and they're comfortable asking you questions. I think a lot of people don't want to speak to their doctor. They're afraid and they get nervous when they come in and they sort of go through the question. They don't even listen to the answers because they just want to get through their question. So I try and slow it down and let them have the adequate time.
No, and like I said, it's super important. Before I met you, first of all, weirdly, your father was my gynecologist like
Oh, I
25
forgot
years
that.
ago.
Oh,
And I
wow.
didn't put that together until many months after I met you.
We'll have a common name, so it makes
Right.
sense.
I don't even know how I put it together, but I was
Yeah.
like, wait a second.
I think there's one other person in the world with my last name. It's my brother. Or a couple
Yeah,
people.
yeah,
That's
yeah.
about it.
But
I'm
your
like,
your dad was super nice as well. It's true what you said. I mean, I went to a few doctors for consults about my face before I met you, and it's so crazy the different opinions you get. Because one of them one doctor's like, you need to do these things, like 5 things, and another doctor said, you look great, go home. So neither one of those did I resonate with. And so you have to just keep looking until you find someone that you feel super comfortable with. And that's the right person. Because people are always like, well, how do you know? How do you choose? And it's just your gut and who you trust and confidence and a good bedside manner.
That's sort of what I grew up with. In other words, people, when I grew up and when I first started, there was social media didn't really exist, and people really chose a doctor based on, recommendations. Their friends went to somebody and then they went to see that person, connected with them, and they used them. Today, people really choose doctors in ways that I find pretty strange, choosing doctors on pictures or social media without really knowing them and understanding what their credentials are and their background. That to me seems sort of a foolish game, but it's very popular now. So for me, I think when you get people in the door, you need to be honest with them, and I don't push things on people at all. I'm honest with them. Most operations can be done individually, but there are a couple operations where you need to guide people in a certain way, because if you don't do something together, it won't look right. Somebody needs their face and eyes done. If you do their face and don't do their eyes, they're not going to look right.
Right.
Somebody has a very weak chin and needs their nose done. If you don't really guide them to do their chin with it, they're never going to get a great result. So there are some things that we need to sort of push people, or whatever you want to call it, in the right direction. But other than that, most things, I think people haven't something that really bothers them, and that's why they've schlepped to see you. So if that's the case, I think that's really what I want to address, and not push them in another direction they don't need.
That's exactly what people need. So when I speak to anyone who's a doctor or a lawyer, I'm already impressed, because I have such admiration and respect for anyone who goes to school for like a minute more than they have to. Because I could barely get out of college, not because I'm not smart. The studying and all that, I just couldn't handle it. So what made you want to go into this field?
Growing up with a father who was a physician, I think is definitely influential in terms of making you interested, and you see how people respond to them. When you have a family physician, you see how people react in the community, especially back then. I think doctors were held in pretty high esteem. And my father loved what he did. So got to live with somebody who really was happy every day. And I think a lot of people don't have that. It's a privilege to take care of people. That's what I was taught, both in my general surgery before my plastic surgery. So when I did plastic surgery, you had to basically do general surgery first. Today, it's not like that. So when you do general surgery, you take care of a lot of sick people, and it's a different sort of mindset and mentality. And then you go on to plastic surgery. So I just grew up with that sort of feeling that it's a great way to spend your life. It's a commitment. It's really long. For me, college, then med school was 4 years, and then my residency was 9 years.
Wow.
5 years of general surgery, your research, and 3 of plastic surgery. So you don't really start working until your mid-ish, late 30s. So it's a long commitment. My younger son's doing it now, but it's a different time frame than it used to be. But yeah, I just grew up with it, and I felt it was the right thing for me, and for me, it's been perfect.
Why did you choose plastic though?
Where I did my general surgery, there's a very famous place for plastic surgery. So as a general surgeon back then, we got to work with the plastic surgeons a lot. And I think, plastic surgery is a really big field in Miami. And now I do all aesthetic surgery. But originally I did a lot of reconstructive stuff. And it's a huge field. Cosmetic surgery is a small portion of plastic surgery. But there's some really cool things to be done, breast reconstruction, head and neck, trauma-related things. So it's a big field. And you get to do a lot of interesting surgery. So for me, it was very attractive that way. I love the surgery mentality. Medicine, I love medicine, but it wasn't for me. Surgery, you have a data set and you make a decision and you do something. Medicine, you talk about it, you maybe order a test, you talk about it some more. So I like the immediacy of surgery. And plastic surgery, I do a lot of different things. So I thought it was sort of cool to go that route.
Yeah, when people think plastic surgery now, all I think about is aesthetics. I don't think about reconstruction anymore, because that's the world we live in now. And I know you said it's not such a big part of what you do anymore.
Well, welcome to Miami.
Right.
Yeah.
Exactly.
I mean, I trained at Harvard, and when I did plastic surgery at Harvard, aesthetic surgery was exactly that. It was a small portion of what we did. And I did a fellowship in aesthetic surgeries to enhance my experience. But in New England, New York, there's a lot of aesthetic surgery, but it is just part of plastic surgery. So Miami, weather, mindset, a lot of Latin culture mixed in, that aesthetic surgery is a very big portion of what we do.
Yeah, I want to get back to that. When they're teaching, let's say, how to do various cosmetic procedures, like, what do you practice on? Is there like a fake body or a mannequin, or you just cut a random volunteer open? Like, what happens?
Well, by the time when you train, when I did, you've already a fully trained surgeon. When you did a
Oh,
plastic surgery residency, you've already had your own, for me, I had my own patients at Bellevue. Because I trained at NYU and we covered the city hospital, Bellevue, and the VA. So you actually had your own services and practice already. So it's a little different. But in your training, I mean, at some point you have to sort of grab by the bull by the horns, as they say. They give you the knife and off you go. It's different operating on somebody than it is operating on some inanimate thing. Although if you look at most interns, you'll see they have sutures all over their scrubs. They're practicing tying knots and that kind of stuff, which is important. We sew a lot, so you got to learn how to tie and sew. And I can't sew a button, but I could sew
right,
on you. So
right.
it's a little different
So I was thinking, the first time you performed surgery on an actual patient, how was that?
versus a fake one. Yeah.
Yeah.
I mean, in plastic surgery or general
Yeah.
surgery, yeah, it was, as confident as you are, because again, you have a lot of training. I
Did
think,
they get a discount because it was the first one?
yeah, we don't discuss those details. But yeah, listen, to say if you're not a positive nervous energy, I would think it's a little strange. I mean, you're just starting out and you want things to be perfect. And most of us who do plastic surgery are pretty finicky about the little things. That's sort of the nature of plastic surgery. So you're definitely on edge the first time. You want things to be right and you want them to do well and be happy, because that's important for you to, your practice to grow. And the first one is always definitely a little bit different than those afterwards.
I came really close once. I dissected a frog in middle school.
Yeah, I skipped that in med school. We didn't do the pith the frog thing. I think that was part of that, but we skipped right to the humans. No frogs in med school.
No frogs.
No
Okay.
frogs, yeah.
Oh my God. What surprised you the most about becoming a surgeon?
Plastic surgery is interesting because it's a very different mindset. When you do aesthetic surgery, it's a very different type of pressure than when you do reconstructive stuff or general surgery. In those fields, nobody knows what's going on the inside, so to speak. The expectations are very different. In plastic surgery, everything is sort of out there for everyone to see. So you're only as good as your last surgery, and everyone wants everything to heal well and heal fast and look great right away. So it's a different type of pressure. I do a lot of facial surgery, so you can't really hide
I always say
stuff,
that.
and people are very critical, and friends are very critical. Everybody says, yeah, I've never seen that before. What's going on? And you got to live with in social media questions. It's a whole different ballgame.
Oh,
So
yeah.
it's really changed the field that way, and people come in with a laundry list of what their friends said and what social media said. So you sort of have to fight against like swimming upstream sometimes. So you have to get used to
Interesting.
that.
Yeah, yeah.
And it's definitely different than when I first started. That didn't
Definitely
exist.
changed.
So
Yeah.
I've had to sort of grow with like this podcast. This didn't exist back when. I'm trying to
So,
evolve.
yeah, let's talk about different types of patients you have. Do you often turn a patient away, not because of a medical condition, because you felt it wasn't the right decision for them?
Oh, I think most of us turn patients away. I would say, I should say, I shouldn't speak for most, but for myself personally, I turn people away when I think that I can't make them happy, or what they want is really not indicated. Like sometimes people come in, they want certain surgeries or certain things done, and I think they're misguided a little bit in terms of how to achieve what's bothering them, or if it's even achievable. So that's one thing. And then I think when you have people who have unrealistic expectations, when you first start out, I think you feel you can conquer the world. They've had 6 people before you have failed, and you're like the right guy to make them happy. But then you realize with time that you're probably just going to be number 7. So depending on what it is, you have to learn to sift through the complaints and figure out who's got reasonable things that are, you can help them, because you don't want to do stuff. I mean, it's surgery. So you don't want to operate on somebody if you don't really feel you can make a real change and really help them. So
Yeah.
you got to weed through and know who is really not the right person and try and get away from that. And early on, it can be hard to figure out, because listen, you want to grow your practice, you want to be busy, but with time you learn, when to sort of say no.
And do you ever turn people away because you think they're unstable or they're going to become a problem down the line? Because I know
Yeah.
friends that have
Yeah.
unstable that have gone to plastic surgeons, and I'm just like, I would not want to be your doctor.
It's
Excuse me.
funny is that most of the time I think I feel like I've hit the nail on the head, and you know when to avoid something, and you just sort of nicely back out of it. But occasionally you do something and you're surprised that person you thought was going to be super difficult turned out to be pretty easy. And the reverse as well, where somebody you thought, wow, they're going to be super easy. And even though everything went okay, it was pretty painful in the post-operative period. So you can't always get it right, but you get better as time goes on.
I guess that's kind of like any relationship in life,
Yeah,
hopefully.
Exactly.
So, how do you navigate the line between helping someone feel confident and potentially feeding into an unhealthy body image?
Well, I think you need to recognize that ahead of time so that you tell people, like, listen, what you're complaining about, not that it's minor to you, but it is very minor in terms of
Mm,
really what we typically see. So that, the change you may see may not be nearly as much as you think. And you don't want to be disappointed, and you try and really somehow drive that home. And if you don't feel you can get that across, then you need to politely back out of it and
mm,
realize that that person is just not understanding you. You're not on the same wavelength. And that happens sometimes where you just feel you're not connecting and you can't really make them understand. And sometimes people want things that are just not achievable for them. Everybody's body type is a little different, and there's only so much you can do. So you have to recognize that if they want a result, I have people bring in pictures sometimes to just get a feel for what they're thinking, because today, like, just to digress, bra size, right? I mean, it's completely all over the map today. What one company is a B, another company is a D. So I have them bring in pictures, so at least we can discuss when they
mm.
say I want to be a C, seeing who, so you want to try and at least see a picture or two to get a feel for what they're talking about. So if you feel you're with somebody and you can't really get on the same page, then you have to figure out a way to sort of politely scoot out of the room when they go to the bathroom or something like that.
And not come back.
Not come back. Yeah. I've had some people that I think I'm not the right person. They need a little different avenue to go.
Yeah.
And there are people that really perseverate on something and it's fairly minor. Again, not to them, not to minimize people's concerns, but the degree of angst related to what they're talking about sometimes is very disproportionate. And
Yeah.
I think I'm not the solution for that
Right,
person.
right.
So,
Okay, that's fair and
this kind of thing.
honest.
Yeah.
I don't know if they're gonna listen to you and just maybe go
No,
to
they just go
somebody
to
else.
somebody else.
Exactly.
That's always the case.
Right.
It's just like when people come in and they want surgery, they want it, but they don't. Eventually they'll, it can work both ways. They'll go to somebody who says, oh, you're not ready, come back another time. And then they're happy. And they just delay the inevitable. I always say, if you've managed to schlep all the way here, come see me and pay for a consultation, it must be bothering you or you wouldn't be here. And people recognize the things that bother them. So if you, just like the reverse, if somebody wants something and you don't think it's right for them, they will search until they find somebody who will do it. Just like injectables. That's a typical example. The over-injected patients. People, if they push you and you say, listen, I think it's enough, they'll go to somebody who
Yeah,
will just
right.
keep going.
Right,
And
right.
they'll just bounce around.
If someone like myself who weighs 100 pounds walks into your office and says, I want lipo, what would you say?
Sure. Why not? No. It depends, because you'd be shocked. There are people who are thin and do have problem areas. Even though they're thin, they do deposit a little bit of fat they have maybe deposited in a spot that bothers them, and they might be a candidate. They also could be loose skin and they're not a candidate.
Mm,
So I don't automatically dismiss it, because I've been surprised when you see people dressed and undressed, it could be very different.
right.
So I think, again, you need to pay attention, let them get changed, take a look. You'd be shocked. There are very thin people who do have areas where they have a little bit of fat. And, Miami's filled with gym rats, people that are killing themselves. They're working in the gym and they have an area where they feel no matter what they do, they can't get rid of it. And the
Right.
rest of their body suffers. Their breasts get small, their face get thinner, but they have a pocket of fat on their legs that never seems to go away.
And that's
So,
what I was going to talk to you about. So with lipo, because I know people who have had lipo, and first of all, do you tell the patient to lose weight first? Because a lot of people I know they need to lose weight first, and they're just being lazy, and they just want it done, and they don't want to work out, and they don't want to diet. I'm not a doctor, but from what I've observed, people that don't do that and they just go get lipo, it comes back, or it comes back in different places. Am I right or wrong?
we love lazy people in plastic surgery, to be honest.
They're
No,
your
they're our
best
best people.
patients,
So the truth
clients.
of the matter is, lipo is not a weight loss tool. So if somebody is really significantly overweight, then really lipo may not be the best thing for them. I mean, there are people that argue that sometimes it's sort of an impetus to push them in the right direction and get, a healthier lifestyle. But in general, people are more, what I would say is normal weight, maybe a little bit, you could be a little bit overweight. That's fine. If they're obese and massively overweight, lipo is really probably not the best thing for them. But lipo works. It's a misconception that it comes back. It comes back if you gain weight. If you don't gain weight, it doesn't come back.
But
So we don't make fat. As adults, we don't make new fat cells. So if you remove it, it's gone. If somebody gains a few pounds, it's not going to come back. Now, if they gain a bunch of weight, it will come back to the areas where you operate, but it'll start to go other places because your body sort of recognizes, well, wait a second, there used to be like 100 cells there. Now there's only 10. and I'm gaining weight. So where I got to put it somewhere. So if you don't gain weight, lipo works. If you gain weight, a significant amount of weight, then you'll start to see some of these changes you hear about.
Okay, that's a good
So
explanation. But yeah, because I think a lot of people are lazy and don't lose weight, and then they gain weight. To
yeah.
me, I just think you make a lifestyle change first and get your body to the best
Yeah.
condition it can be in. And then, like you said, if you have those spots that you don't like, then I feel like that's your
The problem with that is that you wouldn't operate on many people if that's the case, because
right.
people are struggle to, especially weight. Weight is probably one of the biggest things. It's like quitting smoking. A lot of plastic surgeons won't operate on smokers. Smokers have big increased risk of problems. So they're like, if
Mm,
you can't quit smoking, we're not going to operate on you. Lots of people feel that way, but if that's the case, those people would never have surgery because most people can't quit. And weight's sort of the same thing. Most people really struggle if they're overweight to
mhm.
get to some ideal weight to then have surgery. Again, if they're obese, they're too heavy, then you need to do something. And today, with all these semaglutides and Mounjaro, there are people more successful than they used to be. But
Well, that's
it's
my
tough to get to their ideal weight.
that leads to one of my questions. So, are you doing less lipo now since Ozempic has come on the scene? And
That's not a big portion of
two-part
what I
question.
do.
You
Oh,
don't do a
go
lot of
ahead.
lipo.
Not a lot. No.
Okay, so then maybe you're not the right person yet.
Yeah.
But I would think now, a lot of people are losing weight through Ozempic, so maybe there's less lipo. I don't know. But also now skin is sagging. Did people come to you now like they were on Ozempic and they lost a lot of weight and now this is
Yeah.
sagging and that's sagging?
There's a lot of that. Yeah, I
Yeah.
think you're going to see more and more of that. People who are losing weight, and they're probably losing weight more rapidly. So we do see people that are probably coming for skin tightening procedures. That they've lost breast volume, their abdomen maybe a little bit hang, probably necks. I've suffered a little weight loss recently. My neck is hanging a little more than it was before,
I
and
can't see it because the microphone's
well, it's
covering
nice
it.
and dark, and I put the microphone perfect position.
Should have worn a turtleneck.
Yeah, yeah, look, I like that look, sort of Steve Jobs. But anyway, yeah, I
It's
do
80
think you
degrees
see a
out.
lot of people who are going to have more skin laxity that are coming to have surgery. So when you factor that with Zoom, and Zoom has been a big boom for plastic surgery. Everybody looks terrible from below, and you see people being far more critical themselves with FaceTime and video. And I think you couple that with the sort of semaglutide boom, you're seeing a lot of people who feel like they're aging more rapidly and that their
Wow.
skin needs to be snugged up a little bit.
I didn't think about the Zoom. The
Oh,
people
Zoom.
come in and complain I look terrible on Zoom.
Yeah, well, think about it. If you have a
Doesn't everyone look
computer,
terrible on Zoom?
well, yes, and again, most people look terrible on Zoom, but the higher you put the computer, the better you look. You always want to go up to
100%.
down. So most people don't hold their computer up in the air. So if the computer is from below,
Oh, right.
they look
That's
way
why when
worse.
you ask people to take your picture at party, and I
Go like
give it
this.
to guys and they get down on their knees. I'm like, never take a picture that way. What's your instinct to get down and take a picture from below? It's like nuts.
I'll leave you to figure that out.
Yeah, I
But
don't know. People
yeah,
are.
but I think that seriously with Zoom and during the pandemic, you saw a lot of people said, I'm seeing myself on video. I look terrible. And that's a common thing. And I think now with Mounjaro and Ozempic and all the semaglutides and all that stuff, you're seeing a lot of people who are losing big weight, 40, 50, 60
Yeah.
pounds. And when you lose that much weight, especially if you're overweight for a while, that skin is rarely going to snap back the way they would like it to be. So a lot of people coming in complaining of sagging skin and tissue now that want to address it for sure.
Yeah.
Big part of it.
I know it's your livelihood, but do you think as a society, especially in Miami, that we've just gone too far with all the cosmetic procedures? When I go to the gym here, and you were just talking about it, and I see that half the women have obvious implants, BBL, lip filler, I have an anxiety attack. I don't know why looking at people like that gives me anxiety. Like, what is happening, and have we gone too far?
Well, I think that it's a big cultural thing in Miami, like I mentioned before. If you look at South America, South America has always had a big aesthetic market and big influence on people. So you see a lot of that in Miami, more so, let's say, than the Northeast.
Mm.
But I think there's no question that people go too far. They lose perspective in terms of what's normal and what's appropriate looking, especially I think fillers is the obvious culprit in that, people getting overdone fillers. And I think part of that is doctor related, people pushing that idea that you can inject away aging and look great. And I think that as a result of that, people are always chasing this sort of ideal image of youth and looking good. And youth is volume. I mean, young people have lots of volume in their face, and a full face is a youthful face. So I think in search of that, people have probably gone overboard with fillers. I would say that's probably the number one culprit. And I do a lot of fillers and Botox, and I think they're great. But I do think that done poorly or overly aggressively, you
Mm.
need to know when to say enough is enough, that you need to go consider surgery or just backing off. Not everybody wants to do surgery, and that's a big part of it. There are people that want to avoid surgery. So they try and push these things as far as they can. And listen, weather is a big factor. You're here in Miami, or I used to be up in New York. Here, breast body is a big thing.
Yep.
People in t-shirts, bathing suits, shorts, and running around like that. So looking good and being in the gym is a big thing. Not that they don't want to look at elsewhere, but if you look at all the warm weather states, the average size of breast implants is bigger than in the cold weather states. And that has to do with being exposed most of the year.
I wonder, and I was thinking about it on the way here, and I wonder if people with that are fit with better bodies move here because they want to live that lifestyle, or if they move here and then they realize I need to, my body's exposed all the time. I mean, I'm sure it's like a combination.
I think it's actually both. I mean, I
Yeah.
think people who are fit and take care of themselves, and listen, with today, people are able to move with work and live different places. So I think for those people, there are people who love an outdoor lifestyle.
Yeah.
So they want to be in Texas, California, Florida, Arizona, and they want to live an outdoor life. And here year round, people can play tennis, play golf, work out, whatever they want to do. But there's no question that I do see people who have moved here from the Northeast. There's a lot, especially the last few years. And those people, when they see what goes on here, I think they feel motivated to A, exercise more, and B, try and do something aesthetically, because they feel not pressure, but they just see that a certain look and people are exposed. And
Yep.
if somebody's running around in a tennis outfit and looks great, I think people feel like I'd like to be like that. So I think it pushes them to work a little harder and take care of themselves. And then if they feel they've gone only so far with the gym and diet and exercise, that they'll come see us and try and get to the next level,
Yeah.
so to
And
speak.
there is pressure. There is pressure. You can't deny it. A friend of mine,
Yeah.
she's living in Fort Lauderdale, and she's like, I want to move. I'm like, so move to Miami, be closer to me and some of our other friends. And she's like, I'm not skinny enough. I'm not secure enough to live in Miami.
Yeah.
And that was sad, but I understand it because everyone, especially where my neighborhood is,
Yeah.
everyone is so fit and in shape. And if you're not, it's rough.
Well, I think today's day and age, I think people feel, again, with diet and exercise, plastic surgery, and now all these different weight loss things, that there's like no excuse not to look good. So if
Well,
you're
now there really
struggling,
isn't.
yeah, that's what I'm saying. So with all these different modalities available to you, and most of them fairly healthy and safe, I think there is a lot of pressure that people feel that there's no reason to not look better or your best now than there used to be. And especially in a place like Miami, I think there is definitely pressure to keep up with the Joneses and look,
Hmm.
and there's a lot more pressure on women than men, although
Yeah.
we do see more and more men doing things. And it's a young world. So guys, as they get older, there's no question there are a lot of men who want to look young. They feel it's important to look young in terms of the job world. And so I think that men feel the same thing. I think we don't think about that, but a lot of
Yeah.
men are going down the same path.
That was one of my questions. What are common procedures men are getting?
Men, for me, and I probably do a lot of facial surgery. So I do a lot of necks on men, a lot of eyelids are very common. As guys get older, they sort of have the same changes as women, sort of age together. It's like the herd mentality. Women, there's a big spectrum in terms of, because people are doing a lot more treatments. They're doing injectables, they're doing surgery, they're taking care of their skin. Men don't do a great deal. They're all together as one, sort of fall apart as a group. So, but there's, I think, the same thing. You see men, eyelids and necks for me, probably. Love handles, belly fat is a big thing for men. Again, Ozempic and semaglutide is changing that, because a lot of guys have like this sort of internal fat that's not really accessible from plastic surgery. But love handles and belly, really common stuff for guys, that kind of thing.
And you talked about eyes. So you did my eyes. We're going to just let everybody know, and
Yeah.
they're fantastic. And eyes are so easy to do now. And I think a lot of people don't know that you could basically do it on your lunch hour.
Yeah, I mean, upper eyelids, a lot easier than lower eyelids.
Right.
So upper eyelid surgery, it's mostly skin excess, sometimes a little bit of fat, but just in general, more skin excess. And with a little bit of local anesthesia in the right patient, and sometimes we give them a little bit of Xanax or Valium just to take the edge off of things. But
Well, you
even
didn't
just
give
straight,
me any.
I just say some people do straight local if they,
You tortured me.
oh,
I'm just kidding. Nobody offered me any Xanax. Where was mine?
yeah.
I'm
Well,
going to share
listen,
my experience about it. So
yeah.
I did it with no anesthesia, and it's a little creepy, but
Yeah, it's a little uncomfortable, but
yeah, but
once you can talk people through it if you go slowly and just let them know they're okay, and it's going to be a little uncomfortable for 5 or 10 minutes. So once the local anesthesia is in, it's not bad at all. It's just a matter of just staying a little calm. We try and put a little music on to relax people a little bit. The lights are really bright, so that could be hard for
Yes, the lights are
people.
bright. So it's like a little bit of a
Yeah.
Frankenstein
Yeah.
effect.
There's a lot going on, and then you got like the lights, and you feel and you sense people working, but it doesn't hurt. But it's still a little odd having people, sort of sewing and doing all cutting when
Exactly.
you don't feel it, but it's a strange sensation for sure.
Yes, I
So
don't even have to describe it because you
yeah,
just described it perfectly. But if you're kind of brave, I would do it again. It's
yeah.
so not a big deal, but yeah, it's a little uncomfortable because you know
Mhm.
somebody's cutting you.
Well, it
And
goes back to what you said before, which is you have to pick your people carefully. There are people who that's going to be a catastrophe. They are not a local candidate, and you know that
you,
it's not
you
going to work.
trusted
It's not
me.
going to work
You knew
well.
I wasn't going to freak out.
Yeah, every once in a while I'm wrong, but
To
we got you.
people,
We got you through it.
I know I survived and I'm very happy.
Yeah.
So we've kind of touched on this. Like, how do you handle situations where a patient wants to look like someone else? Let's say a celebrity, they come in with a picture of Kim Kardashian or whoever. I don't know, whoever's more popular than her now, but they look nothing like them. And people used to do this with haircuts, and they're like,
Yeah.
oh, the Jennifer Aniston hair. I'm like, but you don't look like her. You don't have her hair. So how do you handle that?
Yeah, I tell them the truth. It's not remotely possible. In other words, I think people should be the best version of themselves.
Yes.
And, I think it's more of a look in terms of like that person has a great structural thing that perhaps, like for instance, somebody with high cheekbones and somebody doesn't have that. Well, with the fillers and things like that, you can sort of augment them and try and get them a better cheek and a better contour to their face. And I think that's part of what they want to achieve and makes them happy. But you can't make someone look like someone else. I mean, you see people, these crazy things on the internet where people are like 20 operations trying to change themselves and look like a movie star or an actor or an actress, whatever. But that to me is crazy. And that's kind of person who you avoid. If somebody really brings in a picture of somebody and says, I want to look like this person, that's the kind of person like what we touched upon before, who you really want to just, if they're really serious, then you really want to sort of back away from that and say, this is just not for me.
Yeah, yeah.
Yeah.
What's the youngest age you'll do like a boob job, nose job? Are there
Yeah.
age restrictions on these things?
There are age restrictions because the way the studies were done. So for women, in terms of straightforward stuff, the silicone is actually 22 and older. That's because
Mm.
the way the studies were designed. So for 18 to 22, theoretically, unless they have some certain issues, they have saline, and then 22 and older is silicone.
Dang, I
Some of the
didn't know
stuff we
that.
do on people is about growth. In other words, rhinoplasty, you want to wait till the person is pretty much finished with facial growth. So kids, 15 and 16 for girls, boys maybe 17. Same thing with breast reduction. You want to wait till they've gone through puberty and their pediatrician feels if they're like have really, very, very large macromastia, large breasts as a kid, you want to wait till they're usually 15 or 16 where they're finished with growth so that I think gives you the best chance of the result being more permanent. So a lot of it has to do with the natural aging, even for kids. That kind of stuff is how early you can do things.
Awesome. Okay, everyone talks about the most common plastic surgery procedures, facelift, boob job, rhinoplasty, like I just said. Tell us some lesser known procedures that a lot of people aren't aware of or anything new that people don't talk about
Yeah.
as much.
Well, a little bit depends on your practice. In other words, I've been doing this a long time. So as you do a long time, I think you sort of get known for something. So your practice tends to get a little bit narrow focus. So for me, I do a lot of, like I said, I do a lot of facials or a lot of men. So I do a lot of male necks, and it's called a direct neck. It's a little unusual, but you can actually operate where we actually make the incision in the central neck. That's not something you can do on women because the scar is unacceptable in women, but in guys it
Mm.
works. So it's not a well-known procedure, things like that. Even otoplasty, I don't think otoplasty is ear pinning. You don't see that as much as we used to, perhaps because a lot of it's done when kids are really young, but there are many adults now looking for that. But my practice is fairly range bound in the sense that I do a lot of breast surgery, a lot of facial surgery. So I don't see a lot of strange, sort of weird requests for certain things. I try and avoid that.
Are there any procedures you definitely don't do?
I stopped doing rhinoplasty. I just decided a couple of years ago that I just had enough of that. And so I do face, eyes, and ear kind of stuff and brow, and I do a lot of breast surgery, but I don't do a lot of rhinoplasty. I do some labioplasty here and there, but I don't do a lot of gynecologic plastic surgery.
Why'd you stop doing rhinoplasty? Too many complaints?
Actually, I had very little complaints, to be
Really?
quite honest, but I think rhinoplasty has evolved, and today we're a lot of open rhinoplasty, a lot of more complicated stuff with grafts and different things like that. And I think for that, you really want to make sure you're doing something that's doing a lot of that because it gets complicated, and your first shot's your best shot with rhinoplasty.
I've thought
So,
about it and I went for a consult. I'm like, I'm too scared. I can't. And also, I've lived with this nose my whole life.
Yeah.
Now I'm going to look like a different person, and it just seems just too weird to me. Plus, I feel like I wouldn't be happy no matter what. And it's
Yeah.
the center of your face. So I'm like,
Yeah.
don't,
Well,
leave well enough alone. Like,
but
don't go messing
rhinoplasty
with.
is tricky. I would say also that just in general, it's probably the least happy people of things we do is rhinoplasty because, the nose, people don't realize, even though it feels pretty solid, the nose is mostly cartilage. And cartilage warps. It's not as predictable as other things. So I think rhinoplasty, as time goes on, people have it done, they look good, and then they come back and it's a little off and it's a little
I've seen
swollen,
that.
and then people are not happy, and then they'll chase that for a really long time trying to correct little imperfections. And the more you do, the worse it tends to get. So I think it's probably the hardest group of patients to make happy.
Yeah, yeah, yeah. I couldn't do it. I know myself well enough. I would never be happy.
Yeah.
And I wouldn't be willing to take the
Well,
risk.
listen, it's good that you recognize that for you personally, you know yourself well enough to know that there's a high likelihood that it's not going to work for you, and to avoid it is probably the best thing.
And then after, when you're not happy, you have no one to blame, really. I mean, you can blame the doctor,
Oh yeah,
but
they got plenty of people to blame.
no, but I'm like, well, now you're stuck with it and you can't go backwards. So,
Yeah.
you have to be really, really sure.
Well, that's what I mentioned before about the pressure of aesthetic surgery, which
Mm-hmm.
is if somebody gets their nose done and they're not happy, sometimes it's very minor and nobody even noticed, and you think it's good and they're not thrilled. But if it's more involved, then it's out there for the world to
Right,
see,
right,
and
right.
they're really stressed about it. So,
Yeah. If you get your boobs done and you're not happy, you can cover it with a
yeah,
shirt. It's a little more concealable than
right.
something in the middle of your face.
Yeah, but like we do a lot of facelifts, and if someone is not looking as natural as they like, it's not much you can do at that point. So it's
Mm-hmm.
it's something you want to be comfortable doing a lot of, which I do, which makes it a lot easier. But if people aren't looking natural, there's no way to hide it, and that's tough.
Another question. You talked about this before with filler. So many women just think filler, filler, filler. And then you realize you get to a certain age and you're just going to have this gigantic round puffy face and you actually just need a facelift.
Yeah.
But now I've heard also that if you get too much filler, you can't remove it and it screws up the potential for a facelift.
Yeah, I mean, listen, overdone filler can be problematic in certain areas, especially around the eyes, because there are a lot of lymphatics there that get blocked, and that can cause like more swelling, and that doesn't always go away. So the good thing about fillers, though, is they do get metabolized naturally by hyaluronic acid, which is most of the fillers, which are the safer ones, I think. There are others that are safe that are good, that aren't HA, which is the abbreviation. But your body has hyaluronic acid all through its skin and your joints, so it has natural enzymes that break down hyaluronic acid, so that a lot of that tends to go away. But there's no question that when repeated injections probably over time causes more scar tissue, so that you'll do a facelift and the filler just comes oozing out. You
Ooh.
see it coming out of the tissue, and if they have enough in certain types of fillers, they definitely have more scar tissue. So a lot of the things people do today, these energy-based devices and threads and all that, they definitely make our life more complicated, because you see people who are virgin face, yet when you go and operate, they have this kind of scar tissue like they've had previous surgery, even though they haven't. And that comes from doing fillers and threads and all kinds of lasers and radio frequency, and all those treatments cause injury that they're not aware of.
That's very interesting because
Yeah.
so many people do these things. And do you recommend, if you want to get a facelift in a year or two, do you recommend laying off the filler
Yeah.
for like a year or something? Or
Yeah, I tell patients if at least 6 months. So if somebody says to me, I want to do a facelift in the next 6 months, and they want to do filler, I recommend they don't. If somebody says, listen, I don't know when I'm going to do it, then I say, listen, then you have to live your life and go ahead and do the fillers or Botox, whatever you want to do.
and lasers
But
as well, they can create a problem.
yeah, laser, well, it depends. There's a lot of lasers, they
Okay.
get grouped together as like one laser. There's like 100 lasers
Yeah.
in medicine. And the ones that go deeper, and the ones that sometimes combine with things that are, devices that go beneath the skin, like radio frequency and things like that, they cause injury to the fat. And when you get fat injury, just beneath the skin is a layer of fat. So if you injure the fat, and you can cause scar tissue, and it definitely can make things more challenging.
That's interesting. I've never heard about that. It's just
Yeah.
educational for me.
Just in case you want to go the next level, you're ready.
Are you ever sitting at a restaurant at dinner and you look at someone and think, I could fix that in 15 minutes?
Honestly, if I feel that way, anybody sitting at the table is thinking sort of along those lines, like, wow, that person could really do something to
Yeah.
fix that. I don't want to sit and judge people. I really try to avoid that. Like I said, if I'm thinking that, then everybody at the
Right.
table is thinking like, wow, that looks,
Right,
something
right,
looks
right.
funny or something looks off. But I try not to sit there and tear people apart. I think that's not a good idea. And who wants to do that all day?
Of
Rather
course.
have a glass of wine and have dinner
I'm
than
joking
that.
with you
Yeah.
anyway.
No, there's a lot of people that do it.
Here's one. Men always say that they like natural women. Okay, right. Are there any left, first of all? I mean, I think they don't realize that the ones that they think are natural aren't. And I think that's the fine line in aesthetics, aesthetics, that you want to look as good as you can. Like you said, the best version of yourself without looking like you've done anything.
Right.
So it's interesting because I've seen TikToks where this girl's like, oh, my boyfriend says he loves how natural I am. And she's like, well, I had my lips done, I had my eyes done, I had this done. And when men don't realize is that now, because nobody's aging naturally. I mean, a lot of people aren't.
Yeah.
That even me, when I see somebody who hasn't done anything, it's like shocking to see them now because it's so few and far between. And it's really sad to say, but that's when I think that, like, oh, if you don't do anything, I think a man will look at you and be like, she looks old. Not everyone.
Yeah. Well, listen, it's definitely something that we see all the time, but I think well done surgery, well done fillers should just look natural. And somebody
Right.
may think, well, that person must have done something because they're 60 and they look way too good. But
That's what I say.
they should look really natural. So nobody should ever look unnatural. It doesn't matter whether it's surgery, whether it's injectables. I don't think anybody wants their husband, their wife to look unnatural.
Mhm.
There are occasionally guys that like unnatural looking breasts. There's no such thing as too big an implant. But I think that most patients want to look natural and they don't want to look unnatural. And their version of natural may be different than my version and your version. But I think the whole thing is that sometimes people, it's interesting. It works both ways because I have people that say, listen, I want a facelift and I don't want anybody to know I had it done. I want to look supernatural. And then people will come in and go, nobody's saying it to me. I don't get it. Why are they not saying I look great? They're saying, well, you look really good. Did you change your hair? Like it's something, it's not as exuberant as they would like it to be, even though they don't want it to be recognized. So it's sort of a double-edged sword.
Of
On the one hand, they
course.
want to look natural. On the other hand, if people aren't complimenting them, they feel disappointed.
Right. The one
So,
thing you don't want is to walk into a room and people go, oh my God, what did you do?
yeah, nobody wants to feel that. And really, to be honest, if someone says that's a great facelift, you can almost argue that it's not because
Right.
it shouldn't be recognized as a facelift. Today,
Yeah.
with the techniques that we use, I think people can look really natural and we don't tighten skin like we used to. So I think people get much more natural results than they used to. And good surgery, good injections, anything, good aesthetic treatment should look really natural. Nobody should look fake ever. It's really not a good thing.
And this is my last question, what's the wildest or weirdest request you've ever gotten?
I would say people that really want to look like someone else and they really mean it, people that want to change their ethnicity, people who are Caucasian who want to look suddenly like they have sort of more of a completely different look than they are and that kind of thing.
You
So
can
that
do that?
no, you can't. They just look weird. I think that they look really funny trying to raise the corner of their eye so they have more of an
Oh,
Asian look and things like that.
okay.
And then crazy size implants. There are people come in with pictures they want to look like these insanely big implants, things
Mm.
like that. So you see these programs on TV and what
Botched.
these botched and all these different programs, and people don't realize that if you spend your day with a reputable plastic surgeon with a really busy practice, you're going to see very mainstream things. And these programs, they filter in, they're looking for crazy stuff and
Yeah.
weird things. Otherwise, it wouldn't be exciting to people. But average stuff, thank God, it's pretty regular. People walk in with very normal everyday concerns, and I think they can get a great result, get on with their lives, be happy, and everything works out nicely.
Okay, one more question. I know I said that was the last one, and this is kind of funny. Do you ever wonder how many friendships start from people sitting in your waiting room? Because to me, it's like drunk women in a bar bathroom
Yeah.
bonding. Have you heard it? I'm sure
Yeah,
it's
I've heard a
happened.
lot. It's funny. I've heard the same thing. I've heard a lot of people that they start chatting with people there and they become fast friends. And then I see people that walk in and they're mortified that they saw somebody that they know because A, they didn't want anybody to know, or B, it's somebody that they have a little bit of a contentious relationship with and they were not counting on seeing them. So there's a whole spectrum of possibilities that occur out there on the other side of the door that I don't always know about and I
Yeah.
hear about when they get in. So that makes my day a little more interesting, that kind of thing. And,
That's like the
women are,
subculture of,
because listen, majority of women today are still women in plastic surgery, and women can be pretty chatty with each other. And when that door closes, you hear a lot of stuff.
yeah.
So, but
Well,
it stays inside the door.
good.
Yeah. So,
Well, thank you so much for coming. This was so awesome.
well,
I
thank you
have
for
a
having
million more
me.
questions,
Yeah.
but we don't have time.
Hey, we'll do it again.
Yeah.
No. Look forward to
round
it.
2.
You got it.
And everyone, Dr. Gibstein, Dr. Lee Gibstein in Miami, and your other office is
It's
in
in Boynton,
Boynton.
yeah, basically just north of Boca.
He's awesome. All right. Thanks for coming.
Thanks for having me.